everyone, and welcome once again to the Healthy Living Podcast. I'm your host, Gina Horan. Today we are talking to Dr. Fernando Serra, local board-certified plastic surgeon. It's great to have you with us, Dr.
Thanks for inviting me. This is my first podcast. Very excited.
Oh, good. Well, we're glad to have you. So, Dr. Fernando Serra, when I first heard of you, I thought, oh, he's going to fly in from Spain or the Philippines and so on, such an exotic name. And I realized you're a hometown kid. You were born in Bushnell and raised here. Talk about your growing up and
absolutely. So I'm Filipino by background. My parents immigrated from Manila to Pennsylvania in 1966. Both my mom and dad were both MDs from the Philippines. And so born in Pennsylvania in 1967, and then when my father completed his general surgery residency, we moved to Bushnell, 1972. I was 5 years old. My father practiced general surgery in Leesburg in the 70s and 80s. So ultimately, I had a wonderful rural childhood, Boy Scouts, baseball, pitching melons in Oxford, saying yes ma'am and no ma'am. And then ultimately followed my dad's footsteps. Undergrad med school, University of Florida in Gainesville. Finished with my MD in 1992. And then I was able to match into a 6-year plastic surgery residency at The Ohio State University in Columbus from 92 to 98. I thought I knew college rivalry being a Gator till I went to the Big Ten, and wow, the Big Ten rivalries. But it was a wonderful training and difficult training. I had a wonderful job opportunity in Columbus with a prominent plastic surgeon, but I was on call at Children's Hospital as a senior resident. I didn't see the sun for a whole week, and seasonal affect disorder is a true entity. If you don't see the sun, you get depressed. So I called my dad, and I said, Dad, I don't know if I want to stay in Columbus. It's so cold. There's no bull peanuts. I think I want to come home. So my father said, you know, son, there's a lot of retirement communities popping up everywhere. In Leesburg, there's this little place called The Villages that's kind of up and coming. So ultimately, in 1998, when I finished my residency, I came back to Leesburg where my father practiced and started my practice, Central Florida Plastic Surgery, Main Street, Leesburg. So it was gonna, really the plan was, it was gonna be a kind of a smaller rural practice because I just wanted to be back home. And I got busy pretty quick. You know, at first I was doing a lot of like emergency room call, hand and facial trauma, skin grafts, traumatic injuries, reconstruction. And then slowly but surely as my reputation continued to progress, then the breast and body contouring started coming in. So by 10 years in practice, by 2008, I realized that all my cosmetic patients were coming in from the villages, and now the village has expanded even more. They got the hospital and everything. And so I moved my practice about 20, 25 minutes away to the villages. So ultimately, grew up in the area, been in the area for 26 years, and just so proud to represent our community, and of course, proud to be able to practice in the villages as well. It's amazing that the only reason I'm here is because I grew up in rural Sumter County, and who would have known that this modern phenomenon, the villages, would have sprouted up in Sumter County. So it's just kind of synchronicity, very good fortune for me as well. I'm just so blessed that I've been able to practice here for so long and just having a great time.
So let's back up a little. You go to undergrad at Florida, go Gators,
Correct.
right? Okay, and then you go to med school at The Ohio State. Now,
undergrad and med school at University of Florida.
Oh, I'm sorry, and then you did residency?
There's a 6-year residency at Ohio State, correct.
So at some point in every doctor's life, they decide their specialty. So, you know, so it's either cardiovascular or, you know, foot, obstetrician. And so talk to me about what was the impetus for you to become a plastic surgeon?
Got it. All right. So I like to tell my patients little stories about myself. First off, again, I had a wonderful rural childhood in Sumter County. I was an Eagle Scout. So I was Mr. Overachiever, earned a lot of merit badges. I looked like a little general, but I was already OCD back then, and I would complain to my mother if a merit badge was a little crooked. One day she flung the needle and said, sew them yourself. So I got good with needle and thread. Sometimes I'd have to do a merit badge 3 times because it had to be perfect. So ultimately, when I went to med school, I was already doing some nice stitch work in the cadaver labs and surgical rotations. And then ultimately, I felt like I wanted to be a surgeon, and I was either thinking about general surgery or urology. But then one of my best friends in my med school clique, Dr. Dan Diaco, who's a prominent plastic surgeon in Tampa, he kind of turned me on to plastic surgery. So I ended up doing a rotation in plastic surgery as a third-year med student at University of Florida and fell in love. Look at all this cutting and sewing. Traumatic injury, skin grafts, reconstruction, congenital anomalies, of course, the cosmetic. So ultimately, I pursued plastic surgery. I was able to match into a kind of a prominent or prestigious program at Ohio State. And so ultimately, I guess I have to thank my mama for making me sew my merit badges on.
I love that. I love that. This is a great time to take a quick break. We'll be right back.
Okay.
We'll be right back with Dr. Fernando Serra. Don't go away.
Is pain or restricted range of motion keeping you on the sidelines? Get back in the game with expert orthopedic care from UF Health Medical Group Orthopedics. UF Health Medical Group Orthopedics provides robotic-assisted surgical joint repairs and replacements, post-operative care, and inpatient rehabilitation services, all close to home, right here in Lake and Sumter counties. And for those unexpected injuries, UF Health Medical Group Orthopedics offers convenient walk-in and same-day appointments. To learn more or to schedule an appointment with one of their specialists, call 352-323-5665.
Welcome back, everyone, to the Healthy Living Podcast. I'm Gina Horan here with Dr. Ferdy Serra. That's your nickname, right?
Correct.
Awesome.
Yes.
So I've heard a few things about you. I'm going to read some of the nice things people have said about you. I did a little homework. Generous, warm, conscientious, detail-oriented, altruistic, and genuine. Now, I want to bounce into a quote that you gave once on a website, which I think is very, very important. The biggest misconception about plastic surgery, and you said, people think that surgery is a substitute for a healthy lifestyle. I personally think that's really important because it seems to me that you balance it. You balance the surgery part with also the coexistence of being healthy on the inside. I've heard that about you. Talk about how you do find that balance and what you do tell your patients when it comes to their outer beauty and their inner beauty.
Absolutely. So again, I'm so proud to be a plastic surgeon, and what the things that I do, it's an honor and a privilege, and it's a huge responsibility as well. And then ultimately, I guess, people are coming to see me perhaps to look on the outside the way they feel on the inside, whether they're younger or older or in between. And so I feel like I've been able to tailor my practice where it's kind of holistic in nature, whether I'm doing Botox or fillers or a smaller procedure or a big procedure, that with kind words of encouragement, sharing my own trials and tribulations about health, and I feel like with a kind word, we can make differences in people's lives. And sometimes people just need a little bit of a kickstart. And then, once they can enjoy the immediate results of a plastic surgical procedure, then they kind of flourish and go on. So I definitely feel like it's not just the surgery itself, but hey, let's look at you as an individual, and what are some things that you can do to continue to maximize your health, your appearance, and your overall happiness. I guess that's what it's all about. I'm conservative by nature, and then I trained at a conservative Midwestern plastic surgery residency program, The Ohio State. And here, especially in the area with all the baby boomers from up north, Midwest, Northeast, a lot of wonderful conservative baby boomers who served their country, paid their taxes, and were disciplined to save for the future. So we have a lot of really sophisticated, big city cosmetologists people here. So for me to be able to flourish here makes me really proud. But ultimately, I really enjoy meeting patients and kind of getting to know them, and hopefully kind of understanding what they're looking to achieve, their goals and aspirations. And then my job, I figure, as a plastic surgeon would be to help maybe figure out the right procedure that would help them with their goals as well. ultimately, plastic surgery is not brain or heart surgery, but it's, pretty intimate and it's pretty important. And that in general, we want to, I really am very careful about patient selection, where patients are interviewing me, I'm interviewing my patients. I just want to hit a home run. I don't want a complication. And also, I work hard towards having a happy patient. And so my success has been to really spend time with the patients on the front end. And by the time the patients were in the operating room, we've already met a few times. They've got my private cell phone number. We're family, and we're going to rock and roll. So because I have this wonderful aesthetic practice, I've been able to tailor it to be more personal, which is kind of my style, I reckon.
So I've heard that you're not afraid to say no. If somebody comes to you, there's a two-pronged question here. One, if somebody comes to you and you feel like they don't need the procedure and maybe they're just, it might be something deeper, how do you consult them?
Absolutely. Well, that's a very good question. In terms of health, we definitely the best results are patients who are healthy. So what does that mean? No smoking. Overall, good blood pressure control, and being within a reasonable height-weight ratio or BMI, those kind of things. And so, like in general, I really avoid working on smokers because one of the wonderful things about plastic surgery is that we can do really awesome things to the body just as long as we know about blood supply. It's all about blood supply and oxygen delivery for the tissues, whether it's a face, breast, tummy tuck. But then if someone's unhealthy, especially with smokers, there's not as good rich blood supply and oxygen delivery, we can see complications. So I spent a lot of time kind of screening my patients for sure. I had a gentleman from the Villages, about maybe 68, looked like a big football player, and he came. I did work on his wife, and he came in a few weeks ago and said, "Doc, I want you to take care of this. I don't have a six-pack, I have a keg." And ultimately, he was quite overweight, and really, really most of his waistline was due to how heavy he was deep down inside. He didn't have really that much superficial subcutaneous fat. So ultimately, with that patient, I said, "Sir, even with the most aggressive or thorough liposuction or a tummy tuck, that because it's all on the inside where I can't get to it, I don't think that it's going to really amount to that much difference." And so then that's when I'll kind of lead into perhaps lifestyle changes, weight loss. And I completely understand about food addiction. I was the fat tuba player in high school. In 2002, I weighed 255, and so I struggle with my weight.
So you understand.
Oh, I totally understand. I'm always thinking about food.
You can have empathy.
Absolutely.
Yeah. Mm-hmm.
But ultimately, I've had good success with intermittent fasting. I find that I'm now pre-diabetic, and I have to keep my weight down so I can be healthy. And certainly, if I'm in the beauty field, in the health field, then I want to live by example, and I want to teach by example too. So it's difficult for me as well. But again, sometimes with the kind words of encouragement, the word is very powerful. Not only the words that we tell other people, but the words we tell ourselves. So, in general, I feel like I'm kind of a positive person, and I just want to emanate positivity, and it's really worked in my practice. I'm also proud that even though I'm now 26 in practice and pretty well established in the area, that I've remained kind of a small specialty boutique. I have my office manager, Joy, and then I have my surgical first assist, Rodlin, and it's just us three. So everybody that comes in, you just see the same people, and a lot of consistency, and it's an intimate practice where we have the luxury to really spend time with our patients and get to know them and hopefully do some great work for them as well.
So you not only do cosmetic surgery, but you have done trauma work, and there's quite a notorious story with you about a young child. He was 18 months at the time, named Nicholas.
Right.
And he unfortunately was attacked by the family pet python. I still will never understand why they're in homes, but not to judge. Anyway, the helicopters were down that day, and this was quite a while ago, and you were asked to help him. Talk about that experience and the fact that you've actually seen him since. Go through that for us.
So I think I started my practice in '98, and I think this was maybe 2000. 2 years in practice. My young practice, Main Street, Leesburg. And so basically, I was on call for plastic surgery ER at Leesburg Hospital, UF Health. It was called Leesburg Regional Medical Center at that time. And it was raining, real horrible weather. And ultimately, the kid, the child who got attacked by the family python should have went to Children's Hospital in Orlando, but the helicopters were down and they ended up in Leesburg. So a stat page on my old beeper and went over there, and ultimately, gosh, all these, first responders and policemen, because it was such a kind of a big situation. And I actually saw the snake in the back of a pickup truck, as big around as a dinner plate. But ultimately, I had done so much pediatric trauma at Children's Hospital Columbus that the CAT scan of the child's brain was normal. It was all still attached, but basically partial avulsion of the scalp. Eyelids were torn off, the ligaments in the eyeball socket, but ultimately it was mostly there. So I felt, hey, I can take care of this. And so we took him to the OR. It was about a 3.5-hour case. Heck, I spent at least half the case picking out teeth and scales, but ultimately was able to kind of put it together. And the child did great. And then afterwards, I got a lot of interviews from all Associated Press and then I was on the headlines of the Orlando Sentinel. Local surgeon saves boy's eye.
Which led to Animal Planet, I think, doing a tiny bit.
So about 10 years ago, I got a call from Animal Planet, and they said, "Hey Doc, we saw your story about the snake epidemic. We're actually doing a show about all the snakes in the Everglades. We'd like to interview you." So I said, "Sure." So they brought a film crew in from LA, and we did some videos and tapes and simulations of the surgery, and they ended up putting it on this Animal Planet episode that keeps being broadcast over and over. So, but I have to admit that that the whole snake bite incident thing kind of catapulted my practice. I got a lot busier. Like, I was a snake guy. So and fortunately, I ran it. I've seen the child around, and he's now a young man, and you can just see a little faint scar, but he did great. So grateful that it worked out.
That's wonderful that you can help people with scarring and trauma like that and other things besides cosmetics. That's wonderful.
Absolutely, correct.
Well, we're going to take another quick break, Dr. Serra. Don't go anywhere, folks. We'll be right back.
Nobody wants an aging family member who is unable to care for themselves to be home alone. Lake Center Home Care believes the best healing happens when you are most comfortable. The company provides exceptional personal care in the comfort and privacy of your own home. Whether you need skilled nursing, physical therapy, home health aides, or companion services, your loved ones will enjoy peace of mind knowing you're being taken care of and treated with respect and dignity. Lake Center Home Care is locally owned and managed with a team of highly qualified professionals who are passionate about taking care of their neighbors. Call 352-315-0050 or visit golchc.com to learn more about this amazing company.
Okay, everyone, and welcome back to the Healthy Living Podcast. I'm Gina Horan here with Dr. Ferdy Serra. I got to get used to saying that. I love that. So there's nothing wrong with getting older. We just, we try in healthy manners to stay young and fit, and you do help people aesthetically as well. But how do you stay feeling young? I know that you do. You have practiced karate for quite some time. Can you talk about that and how that becomes a part of your lifestyle?
So because I have this wonderful aesthetic practice in the Villages, that I've been able to work 4 days a week like a dentist for many years, so I can enjoy my life outside of plastic surgery. So I have 3-day weekends to do things with my wife, Terry, who is actually a labor and delivery RN. She did 18 years night shift at Leesburg Regional Hospital. She's now the director for the Healthy Kids program at the Langley Medical Center in Sumterville, where we all grew up. But ultimately, in terms of staying in shape and my other passions, I've been doing martial arts for many years. When my kids were smaller and younger, they were doing martial arts, and I've kind of continued on with that. I trained with an esteemed martial artist, Ricky Adams, 9th degree black belt with Shito Karate. And of course, I'm not sparring or anything. I don't want to chip a nail or hurt myself. I'm 57, but just kind of working out and the discipline and kind of integrating mind, body, and spirit. It's been a lot of fun. Again, I was in music as a child, middle school and high school, but then when I started college, I got busy and didn't do any music for many years. When I started seeing my wife 12 years ago, when she was just my girlfriend, she started bringing me to these hippie bluegrass festivals in Brooksville, the Swanee Music Park, and Live Oak. So I started going to bluegrass festivals, camping, tie-dye, and then I got into banjo, and I had a banjo teacher. So I'm really passionate about bluegrass. And then 3 years ago, I met this wonderful couple from Ocala, and the wife wanted an arm lift, and I'm always talking to my patient about stuff, and somehow music came up, and the husband of my patient said, "Hey, I did a lot of music in New York and New Jersey. Let's get together." So we got together, started jamming, and so I've been in a music band based out of Ocala now for a couple of years. We've been gigging at various events here in the Villages, biker bars in Ocala and Dunellen. And in this role, we're kind of doing soft rock, yacht rock, that kind of thing, covers. I'm now playing rhythm guitar, and I've got an upright bass as well. So I'm really kind of enjoying the music endeavors and giving back. And a lot of my friends and even patients have come out to see us. My stage name is Outlaw, and just kind of living my rock and roll fantasy as well. But I have to admit that I really I look forward to my 3-day weekends. But after 3 days of doing all that, I find myself ready to get back to work.
So it's a nice balance.
It's a great balance for sure, and I feel like it's just really working out for me as well.
So that was one of the things that we have in common. I used to live 6 blocks away from Golden Gate Park, and they had every year the Hardly Strictly Bluegrass Festival.
Oh, wow.
And that's been going on for like 35 or so years. Emily Lou Harris was one of the big,
yes.
But the thing is that really I thought was really, really special is that it was always put on for free, and I love bluegrass music as well. That's because one of my friends said, "What, all 2 of you?" And I said, "No, there's more, thank you very much." And the festivals are what are so cool. But when you go to these festivals, they're put on for free. How does that really make you feel about the music and the community in general?
Absolutely. Well, I'll tell you, music is food for the soul. It's just so wonderful. And I don't know, I'm kind of an eternal student, and basically, I always had the desire to sing, so I'm playing rhythm guitar and upright bass, but I wanted to sing, but I never sang before, and it was very intimidating. But then my first assist, my surgical scrub tech, she's very devout in her faith, and she started taking voice lessons to sing. I said, "No way," because to me that was the scariest thing ever. Then my wife and I went to her church in Ocala, and she was singing so beautifully, and because she's like my sister, I said, "Well, if you can do it, I can do it." So I started taking voice lessons, and then I broke the ice. I did karaoke on a cruise ship in 2019, scared to death, so tachycardic, I almost didn't do it, but broke the ice, got over myself, so to speak. And so now I've been singing some harmonies, some leads, and just so wonderful. But ultimately, the music thing, it really is food for the soul for myself, and hopefully for the people that are listening to us as well.
Well, is there anywhere anybody can hear you play at all recently or in the near future, or is it on hold, or can you give us
Absolutely.
a little hint where we can go see you?
So I was in a band for 2 years called Bag of Bones, but then 6 weeks ago, the bassist decided to leave and pursue his own endeavors, and we're all still bros. So now we've kind of contracted into a trio where I'm playing upright bass. Lou Berry, our leader, is now playing acoustic guitar, and then we have a drummer named Earl from Ocala. So we've just recently formed a new band called Timeless. And Lou Berry, also, he's a prominent performer in the villages, like Cody's, Lake Sumter Landing, the Lopez, the country clubs there as well. So now that we've contracted to a kind of a smaller three-piece band, we're looking to start booking gigs in the villages. But still enjoying the biker bars as well.
And what's the name of the band again?
Timeless.
Timeless.
Yeah, and so we now have a new Facebook profile there, and we'll be uploading new videos of our band.
Okay, well, Dr. Ferdy, it was so lovely to meet you and great to have you
Thank
on
you
the
so
Healthy
much.
Living
My first
podcast today.
podcast.
Well, you did great.
Well,
we'll
thank
have
you
you
so
back,
much.
and I'll have to go see you with the upright bass.
Heck yeah.
Okay.
All right.
All right, everyone. Well, that's another edition of the Healthy Living Podcast. I'm Gina Horan. We'll see you next time.